Hello, my friends. Andy coming to you live from Orange County, California. I love my intro. I'm not sure how many of you get the little twists and turns that I put in there, but what I wanted to come on and talk to you today is Hetty and I were going to do this together today. That was the original plan. However, she has a deadline for. She writes for an online magazine. They may still have an offline magazine. I'm not sure, called The Christian Post. And that deadline was today. So I thought this was a great opportunity. And actually, it makes sense to talk through this part first, because these are some of the things that I learned along the way in regard to the tests and the numbers. And one of the tests called the Gleason test, I didn't know, or Gleason score, I didn't know anything about until 4 years or 5 years in to this whole journey that I've been on in regard to my prostate cancer. So just in case there's a few people out there that maybe don't have prostate cancer, but I can give you some things to think about and know as you begin to see that your PSAs may be going up and that kind of stuff. And maybe a few of you have not had a chance to see and learn about what a PSA is and what the Gleason score is and what the Epstein score is. So we're going to be talking about all three of those things today. I just want to make sure and put up this disclaimer because it's important. Let me first get rid of this and put this up. And that is, I am not a doctor or claim to be one. I am sharing my opinions and experience only. I am not diagnosing nor suggesting you use any particular treatment or procedure. Any content provided by our bloggers or authors are of their opinion and are not intended to malign any medical treatment, organization, religion, ethnic group, club, organization, company, individual, or anyone or anything else. All right. So important that I just talk to you about that. This is just what I've experienced. These are some of the things that I know. And I want you to make sure and do all of your own research and talk to professional doctors about what it is that I'm talking about so that you can get the full scoop and understand what it is that you're getting yourself into. All right. So since I last talked to you, I talked about HIFU and that was going to be my treatment that I was selecting. And I might have hinted that there's no guarantee that I would be able to have that procedure. I'm not sure if I did or not, but I want to make sure that that's very clear right now, because that was one of the things we talked about in the meeting with the doctor who we're going to be talking to. Hopefully he agreed to an interview, and I will be talking to him soon. What we're trying to do is have it coincide with a meeting that I'll have in regard to the results of some of my tests that I'm about to tell you about. And so I didn't want to have to go there 2 or 3 times and didn't want to take up too much of his time. So that should be coming up shortly. All right. So one of the things that he said in our first meeting is that we need to have another MRI done, a bone scan. He did not say a CT scan, but I had that done anyways. And so since the last time I met with him and since the last time I've talked to you, I believe I've had the CT scan, I've had the bone scan, and yesterday I had the MRI, waiting for the results of the MRI. From the CT scan and the bone scan, unfortunately, they found something else. And so in my chest. And so this is where the problem comes, whether I'm going to have HIFU or not, because if it takes me past there's a certain window that you can have the HIFU. And then what takes you out of that window is cancer getting beyond what the HIFU can do for you. And then other cancers that may be coming. So they don't know for sure. So the Kaiser doctors that I have, remembering my doctor that does a HIFU is not a Kaiser doctor because Kaiser does not cover HIFU. So that doctor is separate from Kaiser. Kaiser looked at the CT scans and the bone scans, and they are the ones who found, or he is the one who found the other issue that they're concerned about. The MRI I had done yesterday was done by a private MRI company that the HIFU doctor suggested I go to. Now, I was really impressed with this MRI. It seems like to be a newer machine. It seemed to be I don't know if bigger has anything to do with being better, but the room and everything about it just seemed more modern. And the number of steps in this MRI than my past MRI with Kaiser seemed to be much more thorough, in my opinion. There was a couple things they did first, and they shot me full of the contrast, intravenously, and there was a lot more done, a lot more buzzing and noise making and that kind of stuff. And so the place that they addressed was my chest now, with the extra knowledge that we had, and then the area of my prostate. All right, so that was done yesterday. I will know the results later on. All right. So I want to give you all the context that, I will still continue to let you know all about HIFU, because I think it's a great alternative, because supposedly the recovery is less, instead of a year or whatever it is, it may be less than a year. Having the bag that you have to carry around to urinate in for a while, that also could be less if everything goes well. Nothing's guaranteed. It's just that it seems like it's less of a pain in the butt. And that's what I'm trying to get to, is less of a pain in the butt. But again, I may have now be taken out of that the possibility of having that procedure. We don't know. All right. So what I want to talk about today after that you know where I'm at, is kind of what are some of the things that we were looking at as making a decision as to doing one thing or another. And then this has been, again, a 5-year, 6-year, maybe longer, 7-year journey that I've been on. We've been monitoring the PSAs, and then suddenly my PSAs have been jumping up. So they went from a 10 from about 6 months to a year ago, and now are all the way up to a 15 or 16. What is the number? Well, I put it in the presentation. So I'm going to show you the presentation here and bring this up, and my PSA, where they're at, and where my Gleason score is, and my Epstein score is also in this presentation from my last, and we'll talk through this from my last results. All right. All right, so let's go ahead, and I'm going to do this. There we go. And let's change the background so it looks a little bit. There we go. All right. So the tests and results, and so let me just go through some of the nomenclature here and some of what it is you need to know. So a PSA stands for prostate specific antigen. Prostate specific antigen, and they take that through a blood test. You go and have your blood drawn, and then they test the blood to get the prostate specific antigen number. And an antigen is any substance that causes your immune system to produce antibodies against it. An antigen may be a substance from the environment, such as chemicals, bacteria, viruses, or pollen. An antigen may also form inside the body. So just to come back to my camera here, the PSA antigen is obviously the antigens that's specific for your prostate. And so in the blood test, it searches for the antigens specific to your prostate, and then they get a score or a number, and that number goes up and down based on whether they believe you have cancer. Now, again, the other thing is what I've been told, and you can do all your research again, is that doesn't necessarily mean that you have cancer. There's other thing that causes your PSA to go up and down, but it's a concern. And then what they end up doing is what is called a biopsy. Obviously, a biopsy is where they go in your body and take a piece of something, pull it out of you, and then examine it. And then that's what they begin to examine to find out if it is in fact cancer. So you can have a raised PSA number and then go in and do a biopsy where they're taking little bits and pieces of your prostate out. And the procedures, there's a couple different ways they do that. I've had both done, and both are not fun. I'm just going to tell you. They say they're fairly painless, but mine were very painful. Where they went through in the perineum to get to my prostate was very painful. But the doctor claimed that there was it's more effective to get as many little bits and pieces of the prostate. And it also didn't cause I've had 3 biopsies, by the way. The first 2 nearly killed me, where I nearly bled to death because of some little things that went awry. That it's rare that it happens, but lucky me, the rare thing happened twice. Lightning struck twice. So the second time, instead of going through through my rear end, they went through the perineum, which is a needle that goes through. And again, that was a little bit painful and caused a little bit more discomfort for a long period of time, and caused me to pee blood for a longer period of time. All right. So, and so from those results, let me get back to my presentation here. And so that's what the antigen is, what the PSA looks for. All right. So then they get your PSA level. So your levels go up, obviously, from 1 to 25. You see the green there is and not so bad. And you can monitor it. That's where I was for a long period of time. when I did this presentation originally, I was in that 10 and below. So I think the last time was like a 10.7 or something like that. But now I'm at a 16.5. So I'm in that blue area, very close to that red area, where when you get in that red area, that's a very dangerous level and you need to probably have something done. All right. So I'm at a 16.5 now. 16.5 was my last test. All right, so let's talk about this Gleason score. Actually, I'm going to come back to my presentation. I've seen that somebody comments. Let me make sure it's not a question about what it is we're covering so far. And it was Amy. Hey, Amy, nice to see you. We're talking about prostates here. I'm glad you're here, though, and it makes me happy that you're here watching, and maybe it's some knowledge that the women may need to know about when they go with their husbands. Amy, I don't believe, is married yet. Last I checked, she wasn't. But who knows? I mean, it could be like Hetty and I, that like one day we don't know each other. Next day we are, more than that. All right. So, women who are watching this is good information because when we talk to Hetty, hopefully tomorrow or the next day, and she talks about what happens when I give her the news I have prostate cancer, she jumped into action and she's, was able to find me the HIFU doctor and did a bunch of research and helped me. Her knowledge in this and her help in me deciding how we move forward has been incredibly needed. And I'm just so grateful of Hedia being a part of this process with me. So women, don't click off just because it has to do with a prostate. You may need, like Hedia, have to help the man in your life make some important decisions along the way. All right, back to the presentation. And so the Gleason score, this is something that I did not find out until later. I'm going to read the description of it here, and then we'll come back and I'll explain to you why this was really important for me to know. So the Gleason score is the grading system used to determine the aggressiveness of prostate cancer. The Gleason score ranges from 1 to 5 and describes how much the cancer from a biopsy looks like healthy tissue. Lower score or abnormal tissue, the higher score. Most cancers score a grade of 3 or higher. All right, so up until about a year and a half ago, 2 years ago, I think it was. I can't remember exactly. So let's just go with 2 years ago. 2 years ago, I'd never even heard of a Gleason score. Now, you would think, Andy, didn't you do a search on the internet to learn? No, I did not. Did you not go to DuckDuckGo? Didn't you go to MD Web or WebMD or whatever it's called? Did you not go there to find out more about your stuff? No, because I'm like some men. I don't know, I would say most men, but I'm just going to say some men where I research the hell out of all kinds of stuff when it doesn't pertain to my health. I will go and get help with all kinds of stuff. When I wanted to play ice hockey, I went and got professional help on learning how to skate before I went out and showed anybody else. I wanted to be as good as I could possibly be, and I searched out help to do that. But when it comes to my health, I think I'm like many men or most men where I don't want to know. I feel like if I know, then I get it or I got it. I don't want to know. I don't want to know. And so I avoided probably doing much research on it. Unlike some other people do the opposite, right? They go, well, you have a hangnail. Oh, let me see what a hangnail is. Oh, no, it means I'm going to die in 5 years, right? That's not me. I don't want to learn that I'm going to die from the research. I think it's the research that's actually killing me, not the fact. I think not knowing keeps me alive. All right. So that's who I am when it comes to this stuff. So I knew nothing about a Gleason score. Long story short, I knew nothing about a Gleason score. I go and see the oncologist because now it's beginning to become more concerning because now I've had 3 biopsies. And the weird thing is, one of the biopsies said I had a small bit of cancer that they were barely able to detect from the biopsy that they took. The second biopsy, they said I had no cancer. They didn't find any of the cancer on any of the tissue samples that they took. And then the third biopsy was the same thing as the first biopsy, where it said, you have a little bit, but there's nothing to worry about. But my PSA scores kept going up. So here's the confusion, and here's where I am today. And this is why this has been going on for so long, is because I have all these mixed messages. Oh, by the way, I also had an MRI along the way that said they did not see any signs of cancer. So I have a MRI and a biopsy that say I don't have cancer, and I have 2 biopsies that say I have a level of cancer. All right. So see my confusion. And then I've had 2 biopsies that nearly killed me. So I'm just letting you know. I'm just telling you all the stories here. So when the Gleason score comes in, now that oncologist tells me, okay, listen, you have cancer. All right. I know that you have a couple tests that say you don't. I know that you have an MRI that says you don't, but I'm telling you, we now have what's called a Gleason score. The Gleason score takes the cells of cancer and looks at them. We have somebody that goes in a laboratory, looks at these cells and grades them. When he grades them, they're grading the number of abnormal cells. The abnormal cells will get a number. And so a 3 being the lowest of the abnormal cells number. So 1 and 2 means that actually they're really not abnormal at all. Then when you get an abnormal one, it starts at number 3. So they'll look and they'll count and they'll see how many 3s they have. And then that will be the first number. And then if there's anything else after that, maybe there's a 4 or a 5 and there's 3 5s and 2 4s, then they'll take the 5, add that to the 3, and then they get you what's called a Gleason score. All right. So let me show you the next slide here, so that you can see what I'm talking about. As they begin to look at the petri dish of your cancer cells, that's what it kind of looks like. That's not actually numbers, obviously. It's the it is the cancer cells. And this trained eye of the person looking at these cancer cells will grade them. And so, like you see here, you have a large number of 3s, and then you have a number of 5s, 1, 2, 3, 4 5s, and only 2 4s. So what ends up happening is they take the high number and the low number, add them together, you get 8, right? So you have a large number of 3s. The next highest number of cancer cells is the 5s, because there's fewer 4s. They take the 3 and the 5, add it together, and you get 8. So that is your Gleason score. So my Gleason score looks like this. All of the cancer cells at the time, again, 2 years ago, when this happened, they were all 3s. The cancer cells were all 3s. The lower level of cancer cells, of abnormal cells. So my Gleason score is a 6. All right, my Gleason score is a 6, as you can see there. That is good. That is what, if you're going to have cancer, then you want your Gleason score to be a 6. All right, so that is where I was a couple years ago. At that time, my PSA was at a 10 something, and my Gleason score was a 6. So at that point, with the help of talking to my doctor at the time at Kaiser Permanente, the idea was, well, it's only a 10 on the PSAs. Your Gleason score is still the lower number of 6. The lowest you can get is a 6. And I said, I really hate to go have. And this is me personally. I'm not telling you what to do. Again, I'm not a doctor. I'm just telling you what my decision was. I'm not trying to influence you. You have to do what you think is right. A lot of decisions are based off my age. Back then, I was 56. So I was 56 then. And they, relatively young, and so they're looking at, well, you have 20 years, you're going to have to make this decision based on your age, based on your Gleason score, based on your PSA, and what type of treatment you're going to have. Is it going to be chemotherapy? Is it going to be those little seeds that they put in you, the radioactive seeds? Are you going to get the HIFU? Or are you going to have the prostate completely removed? And again, I don't want to even go and touch the ones and reasons why you would choose one over the other. That again is really probably better discussed with an oncology doctor or a urologist. And come to your own conclusion based on your age and what it is you're going to do. I'm just telling you based on what I was going through at the time and my age. I did not want to lose the ability to, obviously get an erection, and I didn't want to have to, have trouble with my urination and have to carry around a bag for a long period of time, a year, 2 years, 3 years, whatever it is that you have to do it. A lot of decisions were having to be made based on all of the alternatives that I had, and again, my age. At the time, I was single, and so I was like, I'm just a dad right now, running around, and I wasn't dating or doing that much of that kind of stuff. So I was just thinking, let's just sit this out and see. Let's just see, and that's where this happened. Like I said, as I'm telling you, as we go forward, now we had, we had COVID, right? So COVID, now everything gets put on hold. You can't even really get in to get a PSA. I can't get into the Kaiser because, well, is it COVID related? If not, then you can't come in. Even if you could come in, we're not going to do anything about it anyway because it's an elective surgery. Right? I go, if I'm dying from cancer, it's elective surgery? Yes. And so nothing that was happening during COVID. And then once the restrictions started to get lifted a little bit, I finally said, what? I think it's time for me to have a blood test. It's been a couple of years. Let's see where I'm at. And so now where we're at is that, Oh, I'm sorry. There's a thing there. So sorry. That was my last test. All right. So now my PSA level is at 16.5. So it went from a 10 something, 10.3, 10.4, something like that, to jumped from all the way up to 16.5. Again, I'm still in the blue area, but it's not good. And my levels increased markedly over a couple tests. And so that's when, and so, whatever it was, 6 months ago, I forget now. So Hetty and I meet, I break the news to her that I have cancer. And, she's like, oh no, I can't believe this. This guy who's just started dating has cancer. And as new Christians, there's a lot of decisions we had made about things we weren't going to do until we were married and what we were going to do after we got married. And so there's a lot going on. So she puts her cape on and she turns into Superwoman and she begins to research and do a bunch of stuff. And that's how we find out about HIFU. And now we turn into something where we were just kind of waiting and watching to a more proactive decision making on what procedures and processes that we would be looking at for the treatment of this cancer. And that's where we're kind of at today. All right. And so that's kind of where we're going to be at. And then when tomorrow or the next day, when Hedia comes on, she will be talking about her side of what her decision making was and her decision to help me in this process and all that kind of stuff. We'll have talk to her a little bit more about that kind of stuff. So Paul Byer tells me, and I'm going to bring him on. Absolutely. I would be more than happy to share with you and your viewers my experiences. And I want to make sure and set that up. So we're going to make sure and tackle that. So we'll talk to Hedia in the next day. And then next before the interview with the HIFU doctor, Paul, if you don't mind. So it'll be somewhere in the next few days. I'll get a hold of you and then we'll set up a time and date for you and I to talk about what it is that you went through, your decision making and all your numbers and that kind of stuff to help round out and get another opinion about what is available out there and what Paul's currently going through, because he's had a procedure done recently and he's in the recovery stage of that procedure. So that'll be really important, I think, to bring to the audience. All right. So let me just now pop into the next thing that I recently learned, and that this was just not too long ago, and that is there is another system. It's called the Epstein grading system to kind of simplify, because that 3 plus 3, 3 plus 4, 4 plus 3 thing is confusing, and I didn't quite understand it until I came home, and now I finally started to research, and then I ran into the Epstein grading system. Epstein grading system is a simplified version of the Gleason score, where they take the Gleason score and just give it a simple number, a 1, 2, 3, 4, or 5. 1 being like I had, a couple of years ago, which is a 3 plus 3. So I would be at a 1 at that time. That's why, again, when you look at it as a 1, it makes total sense why, it's just a low grade cancer reading that you can sit and monitor and not really be too concerned about, because the prostate cancer is a very slow growing, for the most part, slow growing cancer based on all the research and what I've been told by the doctors. It's slow. And when you're at a 1 and you want to see, you can sit back and wait and see when it turns into a 2. A 3 plus 4, it's a 2, and then 4 plus 3. So you may be asking, how do you get a 4 plus 3? Well, you have more 4s than you do 3s. Let's say you had like 10 4 10 cell or 4 cells that are so let's say you had 5 or 6 cells that are a 4 and 2 cells that are a 3, then you would be a 4 plus 3. And that equals 3 in the Epstein grading system. 4 plus 4 is a 4, and then everything else is a 5. 5 being you better better take that thing out probably and get that looked into. All right, so that's the Epstein, a much simpler way of looking at it, seeing the numbers and know, well, you're at an Epstein 1, meaning you're very low grade. You're at a 2. Still low, but you got to be more understanding that you're going up, and then the 3. All right, we're going to start looking at some solutions. Probably 4. Come on, let's go. Let's get something happening here. If you're at a 5, you better do something now. Have that taken care of. That's my reading on it. Again, I'm not a doctor. I'm just telling you that at least 2 years ago I was at a 1. I'd really be interested. We're not probably going to do a biopsy right now, but it's possible that I'll have to do another biopsy and find out what my numbers are. I'll be interested to see what my Gleason score is now. All right, so Just to review, you have your PSA, which is a blood test that tells you that there's something going on with your prostate. A PSA number rising up into the 7s and 8s and that kind of stuff. What I've been told doesn't always necessarily mean you have cancer, but it's probably cancer. Other things can cause your PSA to go up. There's a large number of them. It would be difficult for me to go into all those ways that it can go up, but it's not always cancer. But you're going to want to, it's at some point, if your PSA gets high enough, to have what is called a biopsy. You have a biopsy where they go in and they take tissue samples from your prostate, from hopefully many sides of your prostate, so that it gets good coverage, because they can't actually miss it, because prostate is like a little dot sometimes on your prostate, and sometimes it's on the dark side of your prostate that's not easy to get to. If it's on that side and the doctor isn't skilled enough with their biopsy to get back there and get it, it may show, like my second biopsy, show you that you have nothing. My second biopsy said I had no cancer, at least not in the tissues. It was the third one that agreed with the first one, and that is that there was a small bit of cancer in there. From that biopsy, you will then get somebody with a trained eye to look at the samples and find a sample that has the cancer cells on it, and then grade the cancer cells. And when they do that, then they get the Gleason score. The Gleason score is taking the abnormal cells, the low grade ones at a 3, with maybe some higher, worsening cancer cells at a 4 or 5 or so, and look at those, and then you add those two numbers, and then you get the Gleason score. So mine are a 3 being the highest and 3 being the lowest. They didn't find anything higher, didn't find anything lower, and that gave me the score of 3, because you're adding 3 plus 3. If you are looking at the Epstein score, it is the Epstein score based on those Gleason scores. They take whatever Gleason scores you have, and then give you a 1 through 5, 1 being the least amount of cancer, 5 being the worst grade of cancer. All right. So those are the things I wanted to visit with you today. That's just giving you some extra knowledge of things you need to understand as you go forward in your diagnosis of your prostate cancer. And just be cognitive, be vigilant. Don't be like me and try to ignore it for too long. And I'm just hoping this information will give you some tools to go in to ask your doctor about the next steps and what things you need to know going forward. I am, unfortunately, like I told you about going on the internet, having the bone scan, having the CAT scan, and now the MRI. Of course, exactly what I thought would happen. They found more stuff. And so with me, there's a few extra things, I guess, in my body going on that I did not necessarily want to know. Whether or not I'll be able to go through with the HIFU now at this point, it's anybody's guess, but hopefully I'll find in the next couple of days what we're going to do as we go forward. I'm still staying positive, still being prayerful. Hope you guys that are watching if you would pray for me and the results, and that they're positive, and then we can get through this with minimal pain and discomfort, and hopefully I can continue to work and do the things that I like to do, and that's hang out with my kids. So that's the end result that I'm looking for. But we'll be able to get through this, and over the next couple of days, I should know more. Again, Hetty and I will be coming on, and we'll be talking about her role in this journey with me on the prostate cancer thing. And then Paul Beyer and I will get together and we'll learn about what it is that he's going through, his treatment and his recovery. And that'll all be good. All right. Hope you guys are enjoying this. And well, I don't know if you're enjoying it, but I hope you're getting some knowledge from it. And I hope that it's beneficial. If you have any questions or any concerns or things you want to know about, go ahead and write me, because I'll ask the doctors that I'm interviewing. I'm going to for sure interview the HIFU doctor. It's harder to interview a Kaiser doctor. They're very strict on whether he's the HIFU doctor. Pugash is his name. Pugash, Dr. Pugash is way more open because it's a private practice. But Kaiser doesn't, they won't let their doctors talk to me. So unfortunately, I don't have that ability. All right, my friends, thank you for joining. Wow, the numbers went really high there for a second. A lot of people were watching. And so I know this is probably a topic that interests people and they want to know. So again, if you want to know more, if you're watching the replay, type your comment in the comment section, no matter what platform you're watching on. We're broadcasting on Facebook, YouTube, Twitter, and Twitch right now. So if you have any questions, whatever platform you're watching on, write in the comment section your question. That way I can add it to the next broadcast, or when I visit the doctor, I can ask him those questions. All right, my friends, thank you for watching. Take care. And I will talk to you later. Bye.